normal gut microbiota or microbiome plays an absolutely critical role in the pathogenesis of Clostridium difficile infection. And it does so by conferring what is called colonization resistance. In other words, the normal gut microbiota prevents Clostridium difficile from taking hold. If that colonization resistance is broken, typically by antibiotic treatment, this opens an opportunity for Clostridium difficile infection to occur and Clostridium difficile-induced diarrhea and colitis to take place. The mechanism by which the microbiota confers colonization resistance is not well understood. There are several possibilities. It may be competition for nutrients. It may be that elements of the microbiota may occupy a specific environmental niche in the colon that prevents C. difficile from being able to colonize there. Certainly, recently there is fascinating information that one of the roles of the microbiota is in the alteration of bile salts. Primary bile salts are produced by the liver and excreted into the intestine, and they act to encourage germination of C. diff spores and C. diff growth. Secondary bile salts are then produced by bacteria, and they actually inhibit C. diff growth. So that's certainly a mechanism by which the normal microbiota may resist C. difficile colonization. The primary risk factor for C. diff infection is antibiotic or antimicrobial therapy, and that is above and beyond the most important risk factor for most patients, particularly for nosocomial disease, where antibiotic exposure is almost universal. Interestingly, for community-acquired C. diff infection, antibiotic exposure is less common, but is still a common risk factor. The second and third most important risk factors are advancing age and severe underlying disease. Finally, admission to a hospital or a nursing home is a major risk factor, and that's likely because C. difficile spores are prevalent in those environments. And so with the combination of an aging population with increasingly severe and chronic illnesses and increased use of antibiotics with requirement for hospital admission, these factors are coalescing to cause the major outbreaks of C. difficile infection and deaths that we're now seeing across the world. Yes, probiotics have a major role to play in C. difficile prevention and treatment. And in fact, multiple different probiotic agents have been used over time with success in preventing and treating C. difficile infection. Perhaps the most dramatic is FMT, or fecal microbiota transplantation. And that clearly is an effort to restore colonization resistance by restoring a more normal colonic microbiota. However, most clinicians are more comfortable in using better defined probiotics than FMT, ideally using a single agent, be it bacterial or yeast, in order to provide a safer approach to prevention of disease.